Hi, my name is Megan Winter. I don't actually remember why I decided to become a doctor, but my dad tells a story, which I totally believe, of how when I was 9 years old, I saw the inside of an ambulance, and as we were passing in the car, I turned to him and said, someday I'm going to be able to help that person. It was in me, I think, from the beginning. I went to college in St. Louis at Washington University in St. Louis. There I worked in a research lab studying cancer, and I was fascinated at the way that we were starting, but not really quite understanding how cancer developed in the body and what we could do to solve that. While in medical school, I worked actually with a plastic surgeon and saw how every day she used her hands to adjust the way that people used their limbs, improving their quality of life and their ability to return to normal activity after something like an injury. And surgical oncology seemed to me the best way to continue to study the way that the body develops cancer and what we can do about it, but also bring the skills that I had developed in surgery to bear on that disease. I did my residency at Columbia University, where I met my partner, Dr. John Allendorf. I did my specialty training in surgical oncology, where I focused on diseases of the pancreas, cancers of the skin, including melanoma and squamous cell and basal cell carcinomas, and also soft tissue sarcomas, all of which are my focus here at Winthrop. And then after I was finished with that fellowship, came to join Dr. Allendorf at Winthrop Surgical Associates. I think the biggest thing that gets me up in the morning is knowing that while nobody wants a diagnosis of cancer, it's something that's going to happen to many of us throughout our lives. And the best thing that I can do with all of the chemotherapy and the surgery and all of the treatments is also to help that person navigate that diagnosis and the change in life that it brings, and sort of help bring them back to where they want to be at the end of all of that journey.